Greetings, everyone from Dehradun. My name is Dana Hardy. I'm the Executive Director of Begin Ed India and also a part of the LB executive team. We are bringing to you today a very timely session. This session is titled Lactation Professionals in India, COVID 2021 Response. And so we've been with you this whole year since COVID reached India last year in 2020. And we've been having many conversations and providing up-to-date resources. But with the growing COVID cases across India, we wanted to spend some time today with you, just sharing most up-to-date resources, information, and supporting you as you support families across India.
Hello, everyone. I am Dr. Shachi. I am a pediatrician and a lactation consultant. And I have, for the last many years, I've been working with the breastfeeding diet and families. But this COVID pandemic since the last year has made us change many things, has made us learn many things. And more important than ever is to realize that because the guidelines are clear, guidelines are changing. So it is teaching us a lot about how we can support the breastfeeding diets. Now, every time we work with the breastfeeding diet, it becomes very important that when we talk to them, we share whatever is being shared internationally and what are the universal recommendations, because more often than not, when families are suffering, especially through COVID, they get very scared and very panicked. I work in a tertiary care hospital in New Delhi, and in the last 1 year, I have seen lots and lots of COVID positive mothers and babies during the time of their delivery, as well as once they come and get discharged from the hospital as well. So we will be talking about these practical points through this session. Dana?
So I introduced myself already, but one thing that's important about Shachi and I is not only are we supporting lactation professionals like you through the organization LB, but we're also caring for families ourselves. And so I am practicing in Dehradun, supporting families at this point, mostly online. We are in a lockdown at this point, and so that is through virtual consults. And so we're so glad that you are also doing the work across India. And so we hope this session today is very informative. So we have some learning objectives, as we do with every session. We want you to be able to identify the present challenges of COVID in India. As we know, in the last few weeks, the situation here has changed quite a lot. And so not only are we reading it on the news and in the newspaper, but we are experiencing it in our families, in our workplace, in our communities. And so this is a very challenging time for all of us. And so we want you to feel empowered in your role as a lactation professional. How can you support families during this time? How can you support your community during this time? And then we want you to set some goals. What will your work look like in the next week, in the next month, in this season? We know this season will be extended. We don't know how long. Shachi and I cannot read the future, but we want you to know that we're with you in this. And so we're going to also share some encouraging examples of lactation professionals, both networking and supporting families through COVID. So as I already mentioned, we're in this together. Many days when we're home with our own families, holding our own stresses, we feel like we're alone. So we just want to remind you that no matter where you are in India, we are in this with you. And so thank you so much for taking the time to listen today and for being with us in the lactation profession. So this is a question that Shachi and I get asked a lot. What is the lactation professional's role? And so many times when we are working with families ask us, what should they do? And so as we know, as a lactation professional, our job, if you look at these different words below, our job is to support, our job is to advise, our job is to counsel, our job is to share recommendations, and finally, our role is to make a plan together. And so you can take a deep breath, because it's not your job to tell adults, families, communities what to do. what you can do is make an offering. And so you can offer the best suggestion, the best advice you can, and then leave the decision to that family. And you can just follow up with them throughout their journey, whether it's in breastfeeding, whether it's with a COVID situation, whether it's with a challenge with lactation. And so we want to just remind you of this today and in all the days that we work as lactation professionals together. So we know that COVID has changed so much. When we gave a session last March, when COVID was just entering India, we entered a national lockdown. We all had to start working from home. Our children started schooling online. And so those things are continued. But now we know the cases are growing across India. And so Shachi, being based in Delhi, has one scenario. I'm in Dehradun, and so we were impacted by the Kumbh Mela and some of these other big events. And so even in a smaller city of Dehradun, it is really impacting our community. And so we hope that you can learn and take away some points that help you even practice better during this changing time. So I'm going to leave it to Shachi for this slide. Can you share some of the national and international recommendations?
Right. So thank you, Dana. So coming to the recommendations, I'm sure till now all of us have read and known what are the recommendations, and there is no doubt anywhere about these recommendations. They are unanimous. All bodies say the same thing, that irrespective of the parent's COVID status, of the mother's COVID status, the baby needs to be kept in immediate skin-to-skin contact with mother as early as possible. Breastfeeding should be initiated at the earliest without any delay about testing and all that. And exclusive breastfeeding should be practiced for the first 6 months and continued for a minimum of 2 years. So this is not related to the parents' COVID status. We understand that there are many centers all over the country where consciously or like because of lack of resources, families are still separated, but then please know it is because of lack of manpower. It is not because it is recommended. So even when you encounter a family whose baby was separated from them due to maternal sickness or being in ICU or due to lack of manpower resources in their particular center where they delivered, please remember that the guidelines are same all over. So if a mother is COVID positive, in addition to the routine recommendations of skin to skin and earliest initiation of breastfeeding, what is told to the mother is that if she has a mask available, to wear that mask and to maintain proper hand hygiene every time she's picking up her baby to breastfeed. Routinely washing of breast, chest is not recommended. It is recommended only in those situations where a mother has, without a mask, coughed or sneezed over her exposed breast. So what is the rationale behind these recommendations, right? Commonly, when we need to tell a family about these recommendations, they often ask us, how did we reach this conclusion? Why? What made these recommendations being recommended by all the authorities? Simply put, there is no evidence. Lots of researches are being done. Till now, there is no evidence that the COVID virus is transmitted via breast milk. And whenever a person is COVID positive, all her secretions start secreting, all her body secretions contain chemicals against that virus, which are scientifically known as antibodies. So milk is also one of the body secretions. So mother's milk also contains those antibodies against the virus. And when the baby is suckling at mother's breast, baby is getting that breast milk. And breast milk is the optimal food for the baby. So when a baby is feeding at the breast, there is optimum nutrition, there is optimum immunity. And what have been hearing throughout during this pandemic, one thing that is most important, that plays the most crucial role in our getting the infection or living through that infection is our immunity. So if a baby's immunity is optimal, the baby is going to not suffer even if, heaven forbid, baby catches the infection. Because whenever we are in a family and today I test positive, who knows, my other family members were positive before we got tested, and whenever we get tested a few days before that, we have already been shedding the virus, right? And other than that, a mother who's breastfeeding, by virtue of the oxytocin hormone that her body releases, by virtue of her breasts being emptied regularly, especially during the initial days, always stays healthier as compared to a mother who is not able to breastfeed.
So now Shachi and I, we love having discussions. We often do this on our Zoom call or on the phone or in WhatsApp. And so we want you to participate with us. I'm going to ask Shachi some common questions that she's been receiving from families, that I've been receiving from families, that we've been hearing from lactation professionals. And so we hope that this covers some of your own queries, but if you do have other questions, feel free to send an email to either of us, to LP, and we will follow up with you. So first question, Shachi, is I am COVID positive and I just delivered my baby. What should I do?
Right. So as we discussed, the recommendations are clear cut, no changes. Baby will be kept close to the mother. Breastfeeding will be initiated at the earliest on demand. The only additional thing that we'll need to teach to the mother is how to properly wear a mask. Thinking that if the baby has not received the virus till now, because the baby is born just now, mother should not transmit the virus through her secretions while speaking, while coughing, while sneezing. So a good well-fitted mask, even if it is a homemade double layer mask, that should also suffice. But if she has access to a N95 mask, that is always preferable. And in addition to that, she should maintain proper hand hygiene. So another thing that is important for you as well as for the mother is how to maintain proper hygiene. Whenever possible, wash the hands with soap and water, rubbing against all the surfaces, and take at least 20 to 30 seconds to rub the hands before washing with water. So rubbing the soap for 20-30 seconds and ensuring that all surfaces are rubbed.
That seems to be important, even teaching other kids, other adults in the house, especially if we're welcoming a new baby home, because we know that we can quickly wash our hands, but like you're showing, it's really important
Right.
to have that extended hand hygiene.
Right. And in case washing hands is not an option, then also similarly, when we take sanitizer, I've seen people have a tendency to just sprinkle a few drops and do this. So then also it needs to be done in a way that at least you take 1 to 2 teaspoons of that sanitizer in your hands, rub it across, wet all areas, and then keep rubbing till it dries off on its own. So teach to the families as well.
So Shachi, question 2, I am COVID positive. Can I give someone else my baby if I pump my milk and give my breast milk to them?
Right. So this is the most commonly asked question, and for a mother to get this answer, I generally ask them 2 questions. Consider 2 things. You are thinking that you will give your milk to another person who will give it to the baby, right? You can very well do that if you want to do that. But are you sure that the other person is COVID negative, right? If you're living in the same household, even before you start getting symptoms, you are shedding the virus. So mostly when one person in a household, people who are living together, tests positive, mostly all the people are positive. Some show symptoms earlier, some show symptoms later. And also even the COVID test can test negative, but still the person can be harboring the virus. So consider the fact that when you are giving your baby to someone else to feed, you are separating the baby from you. So it is okay if you are not feeling good, you don't feel like sitting with the baby feeding, and you want to take a break and you want to express milk and give it to the other person. But then if you can directly breastfeed, that is always a preferred thing, because breastfeeding is much more than food. It is that body to body connect. It relaxes the baby, it relaxes the mother, it increases oxytocin secretion in the mother, which helps with better immunity and which helps the baby in relaxing also. It is a developmental bond, it is warmth, it is security, it is love, and it is food also. So food you can give if you express your milk and other person gives it. But if you are able to comfortably feed and you're just thinking of someone else feeding your baby because you're COVID positive, please do not worry. Keep your baby close, wear a proper fitted mask, and keep feeding your baby.
So question 3, what happens if a COVID positive mother is sick and cannot feed the baby directly?
Right. So again, we have encountered lots of these situations where the mother was sick and the baby was sent home. Mother stayed in the ICU for quite some time and then she got discharged. So it is very important, if anyone from a similar family approaches any of the lactation professionals, we should guide them about helping the mother regularly with expressing of milk. Now, again, when a mother is in ICU, the ICU staff needs to be told about this. So we have, over the last few weeks, we have seen scenarios where we were so short staffed in the hospital that we were not able to help mothers in expressing also. People were working 18-hour shifts, just running from one bed to another. So it's a good idea to teach the mother also how to do it on her own. So even when they are sitting with oxygen and all, if mother wants to do it, so our job is to tell the mother that it will help if she keeps expressing, it will keep the flow of milk intact, and that milk can be sent home for the baby. Even if nothing else, at least if she can express and discard that milk, that will ensure that her breasts keep producing milk, there is no pooling of milk, there is no engorgement, so she can uh, uh, maintain her milk supply. So if direct breastfeeding is not possible, if mother is in hospital, she needs to express regularly.
So this question says, question 4, I'm facing challenges with breastfeeding. How can I exclusively breastfeed?
Right. So again, these are the times when the lactation support in clinics has dwindled a lot. The the hospital staffs which were involved with lactation support, that has decreased a lot. Many of us have fallen sick and are not able to resume our duties very quickly. So if a mother reaches out to us that she is facing challenges, we help. But what is important is the message which should go out to all the community, that if you're facing challenges, please reach out to a lactation professional in your area. And you can do online consults, because a skilled lactation professional who's experienced can help you online equally. As we say, face-to-face consult is definitely preferable, but since that is not an option at the moment for many of us, it's a good idea to reach out to someone online and they can guide you about the basics through the online consult. And if you remember, please remember, every time, and first I'm saying it for the mothers, if you are a COVID positive person or you are in contact with someone who's COVID positive, please, please, please seek only an online consult. Do not go to the clinics. Please inform your healthcare provider that you are COVID positive or a close contact of COVID positive person. So if you are quarantined, you can do it from the safety of your home, and that will make sure that your healthcare provider is also not put at risk. And for lactation professionals, every time you accept a request for in-home visit or you're calling someone to your visit, please ensure that you have this one question in your questionnaire where you ask that if the mother is COVID positive or is having any signs, symptoms related to cough, cold, flu, or is in contact with someone who's COVID positive, please schedule an online consult and do not do a in-person consult. And in case you are continuing your OPDs and IPDs like me or many other people who are working in hospitals, please think that every person you are encountering can be a potential COVID positive person. So do not let your protection falter. Always, when you are in the premises, wear a well-fitted N95 mask. Keep on doing hand hygiene, keep on washing hands, stay as far away from people as you can, and make sure that whosoever is coming to see you is also wearing a well-fitted, safe mask.
Shachi, I think this is one point where, even though this has been a really challenging year for all of us, we have really seen the lactation profession grow, because even though I'm in a place where there aren't many lactation professionals, we can reach out to people across the community, we can reach out to people across India. And so that's really encouraging to think about all the families who normally may not have taken an appointment, gone in to see a lactation professional in a clinic, in a hospital, who are now saying, oh, I'm home, I can do this from the comfort of my home, my baby can stay safe, I can call the professional when my baby's awake. So it adds a lot of benefits to our work, even though this is not how we would have wanted it to happen.
Right.
So I was COVID positive when I delivered, and I did not feed my baby. Now my baby is a few weeks old and I feel my milk has dried up. Can I get my milk supply back? Will it help my baby if I breastfeed?
Right. So answer to all these questions is a big yes. So many times we have encountered such mothers and babies where initial days, when the hospital was not able to support the mother and baby, or mother was sick, or baby was born prematurely and was in an ICU, there can be a number of reasons for that. But eventually the baby was not fed initially. So if the mother was not guided on how to regularly express her milk, they usually are not able to see milk once the baby is with them, because lots of weeks have passed, no milk expression was done, no suckling at the breast happened. So many times in the initial weeks, the milk gets pooled, mother gets lumps in her breast, and when she tries to express out, because most mothers will just squeeze their breast and will try to see if there is milk or not, so they do not see milk. But our bodies are very wise. They know how to produce milk for our babies. The only thing that is required is patience and a proper plan. So first thing that you should start doing is keep your baby skin to skin, and every time your baby is alert and a little hungry, you see baby moving, searching for the breast, you put the baby on your breast and make plan with a skilled lactation support person, which will primarily constitute how to latch on your baby, how to express milk regularly from the breast, so that now you can tell your breast that you need milk regularly, so that your breast start releasing milk more and more. The way our bodies are, the way our milk gets produced in our body is such that the more you use, the more you'll produce. So if you start putting your baby on the breast, if your baby starts suckling at your breast, and side by side you start expressing each time after you've put your baby on the breast, you'll notice that within next few days, your milk supply will build up. Your baby will start suckling better. And for all of these things, you can take help of a skilled lactation support person. And as far as the question, will it help if I am able to breastfeed my baby? Somewhat. So every drop of breast milk counts, right? You were sick with COVID. Now you will be able to provide your baby with breast milk, which has COVID antibodies, which is something even bigger than when you are just breastfeeding your baby. So every drop counts. And if you work as per plan, patiently, with someone who knows how to support you, very soon you will come to exclusively breastfeeding your baby.
I think that brings up a really important point, because we as lactation professionals need to set up expectations.
Right.
And so talking about time, just because you meet me today and you paid my fees, it doesn't mean tomorrow everything will be back to how you wish. And so just setting up a timeline as we're making a plan of care with families really helps them feel like they're moving forward, and it helps them also not feel like we failed them. And so if together we make that plan with a timeline, this is our goals for this week, this is our goals for next week, because I always remind families, challenges don't come after 1 hour. Challenges come after several days of habits, behaviors, situations, scenarios. So we really have to support families in that way of just reminding them we're with them, but it's going to take some time.
Right. That's a very wise thing to say, Dana, that challenges have started coming because this has been happening for quite some time. So they will not go immediately. Right, right, right. So you need to guide families about looking for skilled lactation professionals rather than going to their obstetricians for breastfeeding related issues or pediatricians, because they again are busy with their loads, and they are not, most of them who are not trained in the field of lactation are not skilled enough to support families through these challenges.
So I think this next question has come a lot. I'm a
Yes.
breastfeeding mother. Today I discovered I'm COVID positive. Should I continue to breastfeed?
Right. So before I answer this question, we all know
Oh,
that
I
answer
showed.
is, yeah. And we all know that answer is absolutely yes. But I want to use this opportunity to talk to the lactation professionals who are listening to this conversation, or the pediatricians or the obstetricians. What we saw, and which was heartbreaking in the last 1 year, was the moment a family was diagnosed as COVID positive, they sent their babies to their own parents. That is, the babies were sent to grandparents. And actually, sadly, we have seen so many deaths in grandparents because of this, because the family feels baby is negative, they get the baby tested, and if you have seen how COVID samples are taken, it is not easy to do a good sampling in a small baby, especially if it is an infant. So more often than not, their tests come negative. Parents get scared. They send the babies to the grandparents, or the grandparents take away the baby because the mom and dad are COVID positive. And what happens is the virus is already there in the baby, and grandparents, who are the at-risk population, they catch the virus, they get sick, and because they are high risk, more often than not, they are very sick, or we have seen some succumbing to the COVID virus also. So please educate the families about, number one, not separating. Why we do not need to separate? Again, as we discussed in the recommendations, breast milk contains COVID antibodies. Baby, in all probabilities, has already received the virus. So once we provide breast milk, that keeps the baby stress free, because again, if you separate a baby from the mother, baby undergoes a lot of stress, especially a baby who was previously breastfed. So when the mother keeps the baby with her, it helps the mother, it helps the baby in terms of not getting stressed, staying relaxed, being fed on demand, and being fed on breast milk, which is rich in COVID antibodies. So good for mother, good for baby. So no separation is needed. Breastfeeding will continue as usual. And if they have access to a good mask, which most of us have, tell them to wear a mask, especially during those times when she feels she might cough, or she might talk, or she might sneeze. So it's a good idea to wear a well-fitted mask and do hand hygiene before putting the baby to breast.
So this question's a little bit of a shift because now we're talking about pregnancy.
Yes.
What are the recommendations for those who are pregnant or yet to deliver?
Right. So see, why did we have this slide here is because there is something called anticipatory guidance. So in these times when the COVID pandemic started, what was a big teaching experience for us at my hospital was that many families went home feeding well, everything is going fine. And one fine day I get a call that, doctor, we have sent the baby to my mother because I was COVID positive, my baby was negative, and now the baby is with my mother. So we realize that if we are not talking to them about COVID recommendations, even when they are not COVID positive, usually they are not reaching out to us before they have already separated their babies from them. So anticipatory guidance is something that is very beneficial now in these times to the pregnant couples. So every time you take an antenatal class, every time you encounter a pregnant couple, a pregnant family, be it in your own family or as a client, please guide them about the following points. They should be prepared for breastfeeding. So why breastfeeding preparation is more important than ever now? Because again, breastfeeding is immunity. breastfeeding is health, breastfeeding is food, and breastfeeding is food security. If you remember those initial days of lockdown, there was so much chaos, there was so much stress all around the world. What if we don't get proper foods? What if I don't get XYZ food item? So when a baby is breastfeeding from the mother, the family does not need to run helter skelter to procure formula for the baby. And that's something that many people understand, even if they do not understand the significance of breastfeeding. And yes, as lactation professionals, it is our job to guide the families about benefits of breastfeeding and risk of not breastfeeding. Because if a baby is not breastfeeding, the baby encounters diarrhea. Now imagine in these times you have to run with the baby to the hospital to get the baby admitted. You are going in a potential, not potential, you are going in a disaster zone where anyone can be infected, where your healthcare provider can be infected. So it's a good idea to talk to the families during their antenatal period so that they are prepared with what to do and how to do. They are prepared to take solid infant feeding decisions. They are prepared with a plan B. What if I'm not able to immediately feed my baby? Then I have a plan B. Okay, then I'll do this. I'll express milk and I'll send it to the NICU, right? So they all antenatal families should ideally attend breastfeeding preparation classes, or if they are not able to do that, they can at least start reading about it as much as they can. They should stay at home. They should not go out. They should not have relatives, and even those relatives who appear to be non-infected, because who knows, that person can be in an asymptomatic stage. So suppose I am pregnant and I catch COVID. Again, visualize the scenario, because again, pregnant females are at-risk population. Then talk to your doctor and family in advance. Why do you need to talk to your doctor in advance? Wherever you are going to deliver, if your doctor knows that you have planned to put the baby immediately skin to skin, to feed the baby immediately at the breast, that always helps, because then they can tell the staff in the hospital to not give anything else to the mother and baby diet. See, ideally, everyone should know that they should not give anything. They should keep immediate skin to skin, because at the moment, the current scenario that is there in hospitals, even in hospitals with trained staff, which were breastfeeding friendly, things are going a little haywire. So it's a good idea to ensure that you have talked to your doctor, number one, and you have also talked to your family. So how I teach my family is, one person is responsible for the mother and one person is responsible for the baby. So the moment you have your baby, make sure that you are informing the nurses, the doctors, that you want to initiate breastfeeding. You do not want to do anything else. You do not want anything else to be given to your baby, right? And guide every family to read recommendations. Why? Because knowledge is power. So once the family knows that these are the recommendations, they will not get scared. Suppose I'm COVID positive. I don't know that I'm positive. I went to the hospital and before admission, they did my test. Now I realize just before delivering that I am positive. So I am at a very vulnerable stage right now. But if I knew from before, okay, even if I'm COVID positive, it's okay, makes no difference. Bring my baby to me, give me a mask. Anyhow, I'll be wearing a mask in the hospital. Give my baby to me and I'll breastfeed. But had I not known, if I was not aware of the recommendations, I might listen to some XYZ person who says, oh, you're COVID positive. I think we should separate your baby. I think we should first test your baby. And then maybe if the baby is negative, we should not breastfeed the baby. So please guide your families about reading recommendations by all national, international bodies. Even ALPI on its website has clear-cut practical recommendations. BPNI has excellent infographics. WHO has information. ILCA has information. So guide your families there. And for those families who are listening to this conversation, please make yourself aware about these recommendations. And also read about in-person accounts. Applies to both lactation professionals as well as families. Read about experiences of people who fed, who could not feed initially but initiated later on. What are the challenges they encountered? Because reading about other person's experience many times gives us certain clues about what we can do so that those challenges do not come to us, right? And once your baby arrives, so this was before the baby came. Now once your baby is there, irrespective of anything, whatever your COVID status is, if it is tested, if it is not tested, if you're having cough, cold, does not matter. Put your baby to breast, because baby gets immunity from your breast. If baby gets something else, that causes a decline in baby's immunity. And once you're breastfeeding, if you face any challenges, please reach out at the earliest to any skilled lactation support person who you can get hold of. Your hospital might be having some people on board. You might be able to see them face to face. You might not be able to see anyone face to face. Reach out to people who are doing virtual consults. If nothing else, at least you will get to know what else you can do in your present scenario, whatever scenario you might be in, which will help in establishing breastfeeding.
So this is a big question. We both go to many resources when we're talking about compatibility of medications and breastfeeding, but how would you recommend proceeding when the questions come about medications and breastfeeding?
Right. So this is such a common question that I get this question even from pediatricians also, even from moms who themselves are healthcare providers, doctors, and they are still worried about it, because more often than not, if you open the package insert of any medication, they always write not recommended in pregnant women, not recommended in breastfeeding women. And do you know what is the commonest reason of these recommendations? The commonest reason of these recommendations is that that particular manufacturer has not done enough research before manufacturing this medication. So these are primarily for medical legal purpose. Why? Because any allergy can happen to anyone. So in case I get any allergic reaction or my baby faces any challenge, I don't sue that manufacturer. So remember that most medicines are passed into breast milk in traces in very insignificant amounts. And most medicines, even if mother is sick, are given for a short period of time. Here we are right now talking about COVID specific medications, not if a mother is on anti-epileptic or any long-term antipsychotics. We are talking about short-term situations where it is given for a few weeks or a week or so. So if you remember these three basic points, that because there are not ample researches and it is passed in traces and medicine is given for a short period of time, most of the medicines are safe. But then it's a good idea to share with your families the resources we have outlined in these slides, and two very common and like authorized sites are, one is infantrisk.com and another which I used most is LactMed Toxnet. So if you put in Google LactMed, LACTMED Toxnet, TOXNET, you will get that their website. And if you just type in the generic name of whatever medication the mom is taking, that comes up, right? So number one, remember the basic aspects. Number two, you don't decide, you give them the information, you read up about those medications and discuss it with them. And number three, very importantly, suppose you guys don't find anything about that medication, or the site says that use with caution, or the site says that some babies have been found to have this and that. So remember to explore all options with the family. Like, for example, is it possible to maybe use some alternative medicine? The family can talk to their healthcare provider. If that's not possible and the family strongly feels, looking at these recommendations, that no, even if it is secreted in traces, I'm not willing to give it to my child, remember to teach the mother to express and throw her milk. Although having said that, in most situations, uh, medicine is not harmful, medicine is secreted in traces, but still if the family is unwilling, or if the healthcare provider is unwilling and because of that the family is not willing, teach the mother the significance why she needs to express and throw during those times when she is not feeding, if she has decided that she would not want to breastfeed. But do guide them towards these resources for the medicines this time, as well as for the medicines that she might be eating in the future, so that they can take an informed decision.
Right. And many moms who are having COVID or babies or things like that are passing through and healing, but we know that some cases turn into an ICU admission, a ventilator. So then they should consult their medical team and really make the best decision together. That is a
Right.
terrible, horrible situation, a very critical situation. But we know that we can support families even through those challenging times.
Right. Basic goal is that the way we talk to families, we should not confuse them. We should not give antagonistic statements against their healthcare providers. And we should not, because that all puts the families more at stress. So it's a good idea to talk them through these points, discuss the pros and cons of various decisions, and then just gently guide them to these resources. And I tell you, the families are so intelligent and smart. They always take the best possible decision in their scenario.
So, as we know, the vaccine drive is continuing around India and globally. And so we are getting a lot of questions about, can breastfeeding women, breastfeeding families, can they take the COVID vaccine?
Right. So I got this question more from lactation professionals than from mothers. But yes, from the last 1 week, mothers have started calling me about this question because, as we all know, from 1st May, it is open for everyone who's over 18 years old. So the question is, should a mother who's breastfeeding take vaccine? Yes. Should a mother who's breastfeeding and decides to take vaccine, should she stop breastfeeding? No, not because of the vaccines. And on this, just a few days back on 21st April, this is a guideline that came from WHO because there was a whole lot of controversy and confusion around it. Although CDC since the beginning has given, always stayed on the statement that mothers who are breastfeeding should be offered vaccine and should take the vaccine. Seeing the current scenario in India and realizing that it can worsen even beyond this, the risks and benefits involved for a mother who's breastfeeding are more or less same as compared to a person who's not breastfeeding. So no harm to the vaccinated baby. In fact, lots of studies are showing that when a mother is vaccinated, she passes some antibodies to the baby as well. So we are going to give you a link for this article. Do read it and share it with the families. This is the link, and this is the WHO update on 21st April. So to answer the question in one line, please go ahead and take a vaccine. In the last 1 year, all healthcare providers who were breastfeeding or not breastfeeding, they have taken the vaccine. So it is absolutely okay. We have some logistic issues in terms of when you go, if you're a breastfeeding mother and you go to a vaccination center and you are being asked if you are breastfeeding, if you say yes, because the government has still not given orders in relation to this new guideline, so they might send you away. They might tell that we are not giving vaccines to a mother who's breastfeeding. Then I would urge you to think about it and see how you're going to deal with scenario. On the personal front, my family members who were healthcare providers and who were breastfeeding, actually they did not say that they were breastfeeding, but they all have received the vaccine. So this is one individual decision that you need to make. But as far as the knowledge goes, is it safe? It's absolutely safe for you as well as for your baby.
So Shachi, we all have different stories from different families, from different communities, but we wanted to just spend a few minutes just discussing some cases where there was a COVID positive mother or baby and just what the breastfeeding situation was. And so your first case that you shared was about a COVID positive mother who had a normal vaginal birth. Can you share a little bit about that one?
Right. So although this case looks very small on the slide, this was a more challenging case for me because what happened is mother got admitted, and routinely when mothers are admitted in hospital, their testing for COVID is being done. So mother delivered, baby was with mother, and then the test came that the mother is COVID positive. Now the whole family went into a straightaway panic mode. They picked up the baby. They said, please discharge the baby. We are going home with the baby, and the mother will stay here because the mother is COVID positive and we are not going to initiate breastfeeding. So this was a situation where we spent quite some time. The pediatric unit, which was responsible for the baby, and the obstetric unit, and we talked with the family and we taught them about the recommendations. We discussed with them the pros and cons of taking the baby home, where other family members might also be COVID positive, and breast milk not containing the COVID virus, but breast milk containing the COVID positive antibodies, like anti-COVID antibodies. So listening to all this, you will not believe it took us 3 hours to initiate breastfeeding in this baby, because we did not want to do it by just ordering it. We just wanted the family to take a decision on that, and we were perfectly okay if they decided to still take the baby home. And then once we discussed all that, the parents and the grandparents too, they decided that they would like to start breastfeeding the baby, and they actually left the baby with the mother, and both of them were sent to the COVID ward. Again, this is a situation which is very scary for the family, because they think that, oh, all the people there would be COVID positive. But then, because the mother was also COVID positive, everyone was wearing a mask, and all those precautions were being taken. The baby was taken to the COVID ward, where the mother kept breastfeeding. The mother and baby got discharged next day early morning. The baby was tested again for COVID after 48 hours or so. I don't remember exactly. Baby came COVID negative. They kept breastfeeding the baby. And right now the baby is 7 months and continuing with breastfeeding, and also started on complementary feeding, because we are in touch with our families who went home. So things settled, but it took lots of time and joint decision making, the family, the obstetrician, the pediatrician, and the lactation professional.
So your second case is about a mom who was post-cesarean, post-C-section, and then the baby was shifted to the NICU. Can you tell us about that one?
Yes. So I picked up this case specifically because, again, as lactation professionals, you might encounter many cases like this, or as a parent, you might be going through this. See, this was a logistic problem with us. Mother has had a cesarean section, and mother got really sick. The mother's SpO2 was falling. The mother needed ICU support. So mother was shifted to the ICU. Now, in these kind of situations, baby is kept in the NICU if there is no one in the family to take the baby home, because the whole family was COVID positive and they were scared to take the baby home, and mother was also not home. So what happened? The baby was kept in the NICU. The baby's test came out negative. So the baby was kept in the normal NICU. Now, mother was sick initially, and she was so sick that even initial 2 days, no expression could be done. Even with the help of nurse, no expression could be done. The nursing staff was in short supply. The mother was very sick. She was not able to do it on her own. So nothing was done. Day 3 onwards, mother's oxygen status started stabilizing. Her oxygen requirement started getting lesser. And I was in touch with the mother through WhatsApp calls from the NICU. So 3rd day onwards, mother reached out to us and she said, now I'm able to sit on my own and I have started pumping, but I'm not seeing any milk. We just kept encouraging her to express. And by the end of 3rd day, she was actually taking out milk. But again, another logistic issue that happened on that day was we were not able to receive her milk in the NICU because no one was available to bring that milk to the NICU, and the NICU people were actually worried about getting contaminated milk. So it took us few days to solve these logistic issues. Unfortunate, but yes, this happens in hospitals, especially during these times when we are working on low staff and lots of chaotic things happening. So day 4 onwards, we started receiving her milk. By day 7, baby also got discharged, mother also settled, mother got discharged, and the baby and mother went home. And mother started giving express breast milk to the baby, and we kept guiding her about to latch on her baby, and all this was happening via video consult. So it was not happening face to face because the mother was so sick, mother was positive, so we were not seeing her face to face, and she was not able to take long calls also. But then she kept putting the baby on the breast, she kept expressing, her family kept helping her, and by day 15, the baby came onto direct breastfeeds. So we supported the mother by troubleshooting for her issues once a day, every day. And also we supported the mother in ensuring that slowly and steadily baby is latching well. So we guided the mother about how to assess if the baby is latching well, how to assess if the baby is getting adequate milk, how to assess if the baby's outputs are adequate or not. So by day 15, the baby came on to direct breastfeeds totally. So from first 2 days where first 3 days where zero amount of breast milk was going, to day 4 where express milk started going in, to day 7 where total express breast milk was going, into day 15 where exclusive breastfeeding started happening. So baby today is 17 days old, and actually I did a consult with them today also, and the baby is exclusively feeding with no challenges to mother or baby.
That's a great story, Shachi.
Thank you.
Well done, all of you, huh?
Yes. So even if things do not go right, please prime your families with anticipatory guidance so that they don't think, oh, first 2 day, first 3 day, first 7 days, nothing happened, now nothing can be done. There is always something that can be done.
Right. Yeah, and it helps to frame it as, this is a challenge today, but you're not a complete failure.
Right,
Let's talk about the challenge today, because if
right.
they just feel like, oh, I failed, I will never breastfeed, then this confidence is completely gone. And so meeting families in that despair and saying, no, this is the challenge today. Let's make
Yes,
a plan to make it better for tomorrow. So that
right,
really helps. Those are
right.
really encouraging cases. So I wanted to remind us of this. So many of us are feeling higher stress, not sleeping well. We are sick, our family members are sick, and then we're caring for families who have COVID positive situations in their own lives. And so I want to remind all of us as caregivers, as lactation professionals, that we need to take care of ourselves first. And so I was talking with someone yesterday who is preparing for the lactation board exam, and she's having to readjust her timeline and is feeling quite discouraged. But not only did she have a family member pass away, but she also had a sick husband with COVID. And so when so much is going on in our lives, we sometimes have to take a step back. And so if you're used to seeing 20 families in a week and having 20 appointments, and you're trying to do this, but you feel like you're on slow motion, you're just so exhausted, why are you feeling sad? Then take a pause and assess that in yourself. And so maybe that's a week where you need to take a few less appointments and build in some rest for yourself. Because if we say this like a petrol tank, if we are on empty, or our battery, our cell is on very, very low, and we're not recharging, then if we recharge a little, then we're low, and then we recharge a little, and then we go lower, and then eventually there's nothing left for us to give. And so I know it's a really stressful time, and that each of you care for your own family, you care for the families in your community that you're supporting with breastfeeding. And so I just want to remind you, Shachi and I want to remind you to care for yourself, take deep breaths. A lot of the normal living that we all are doing right now is not the same. And so don't be surprised if you're not sleeping well, you don't have much appetite, things like that. So just be sure to have people in your life that you're sharing that with, someone who's also checking in on you. Maybe you have another lactation professional in your city, and you can call them and just say, I'm not doing well, how are you? Just asking those questions, just putting it out in the space, saying the words, I'm exhausted. And then they say, Shachi and I do this all the time, I'm exhausted too. So then you can encourage each other and you can take on another day together. So we're very thankful for each of you and all the work you're doing in your communities, but we want to make sure that you're also taking care of you.
Right. And it's also a very good idea to have some ritual in your life. It can be a few minutes of daily exercising. It can be sitting in your balcony. It can be just spending some time hugging your children. Do that. We don't realize, but this pandemic is taking a toll on our mental health. So do that. Please do lots of things for yourself, even if they are small, small things scattered throughout the day.
Right. For me, my coffee mug is usually this big, and now it's a little bit bigger because I love that time just drinking that slowly to begin the day, whether it's
Right.
chai or coffee or drinking more water. That's good, Shachi, to remind us to continue those rituals. Sometimes when we're so stressed, we just think, oh, it's okay, just
Yes.
keep going. But continue the rituals that keep you sane and healthy, like you're saying. Very good. So I've learned about Shachi. There's something called love languages. So I always joke with Shachi that her love languages is research articles. And so we both love resources. And so you can see a list here. We can share the slides with you. There's 2 pages of resources with different websites and different organizations that have been keeping up with the COVID situation. Shachi, do you have anything else to say about this?
No, I think that's it. That's the gist of all that we wanted to say.
Okay, so I think we can close the session for today. This is not going to be the last time we're talking about this, but we're here with you, Shachi and I, together from our different respective locations. But we're glad this year that we all have learned even more how to connect online. And so we look forward to continuing to connect and sharing our own stories, our own case discussions of successes and healthy families and healthy babies across India.
Take care of yourselves. Please stay safe.
Bye, everyone.
Bye bye.